Okay, today we're just going to talk about something that we see a lot, and I think it's really important to go over because people get very worried about it and they think that they can't do anything about what they've been shown. And by that I mean when people go in and get x-rays or imaging, MRI and imaging of any kind, and they've been told if it's their low back, for example, that they have disc degeneration or they have a herniated disc or anything of that nature. There's actually a study that I pulled up, and it's done in 2014. They took over 3,000 patients and they did MRI imaging, so good imaging of their low backs. These are asymptomatic subjects, so they had no pain at all. They had no symptoms, nothing down the leg, no sciatica, nothing. And they found that a ton of them had disc degeneration, disc bulging, disc herniations. Some of the actual numbers are pretty staggering. Disc degeneration in 30-year-olds was at 52%. So if you would have done an MRI on the 30-year-olds in that group of 3,100 total, not all were obviously 30 years old, but the portion that were 30, half of them, or over half, had disc degeneration. Disc bulging in your 40s, which is pretty common. A lot of people have back pain. They go to the doctor, they go somewhere and they get disc imaging or they get low back imaging and they find disc bulges. 50% of those in their 40s have a disc bulge that have no pain at all. So just because you find that you have pain in your back and you go somewhere and then you are told that you have a disc issue or degeneration, which is really common in the low back or in the neck, it applies to the neck too, doesn't necessarily mean that's what your issue is. So then there's something else going on, whether it's the nerves are just irritated, there's something with the muscle, but that's where it's important to realize that you can do something about it and you don't necessarily have to go in for surgery or injections or anything like that. You can get maybe some exercise, something like that. There's a good study that if you do some specific low back strengthening, you can decrease your risk of having low back pain by 50%. So just by being shown some exercises you continue with on your own, it doesn't require you to see a massage therapist, a chiropractor, a physical therapist, or anything like that. So it's important to be looked at, see what's truly going on if you have immobility, if you have weakness somewhere, if anything else is going on, and that maybe it's not really the disc that's causing the issues. So that's a good one that people freak out about, and sometimes you need to look a little bit further into it and not just read the imaging, but actually see what you present as and see what the patient actually has going on.